Some say it is witchcraft, wengine wanaamini pia ni laana. People believe it is a disease of unknown origin. Others believe it is a mystery. Wengine wanaamini kwamba ni ugonjwa wa wazee or the aged people. Ila wengine pia wanaamini kuwa ni ugonjwa wa matajiri ama wenye pesa. Others believe that it is a tumor or a growth that grows in the body, while others believe it is a disease that is caused by other bacterial infections just like other infections. Yeah? So, cancer aswa ni nini? Ama ugonjwa huu wa saratani ni nini? Hello guys, hope you are doing fine. Welcome to our channel. This is our channel. And I'm welcoming you to our first episode of the cancer series and hope you will enjoy. Now, scientists have defined cancer as a disease characterized by the abnormal growth of cells which grow uncontrollably and move beyond their border limits, or they grow beyond their borderlines. You can also define cancer as a disease whereby cells grow uncontrollably and they spread to other parts of the body. So we've talked about cells. A human being has got trillions and trillions of cells. You've got trillions of cells, I've got trillions of cells, and these cells are specialized to perform a specific function or task. Najoeleza kwamba ni kwamba uko na cells mingi kwa mwili wako, niko na cells mingi kwa mwili wangu, na these cells zinafanya a specific function. There is a specific functions in which these cells work in your body. So I think you'll allow me just pick one of your cell from your body and then talk about this one cell out of the trillions in your body. Allow me talk about one cell in your body. Na nitaingia ndani kidogo tu, but hamtapotea. Now this cell has got both the nucleus and the cytoplasm. Your cell has got the nucleus and the cytoplasm. Inside this nucleus, there is what we call a chromosome. Na najua biology yenu mlisoma kitu kama chromosome somewhere. Now inside this chromosome, there's what we call the DNA, or where the genes are stored. Genes ni kama vile ambavyo ulizaliwa, ukapata genes za wazazi wako, ama pia mtoto wako akachukua genes zako. So the cells have got what we call genes. They pass this genetic information to other cells. Yeah? Now, there are genes inside these cells, and I'll just talk about 3 genes. Number 1, we've got what we call the tumor suppressor genes. We've got what we call the proto-oncogenes. And then we have got what we call the DNA repair cells genes. These genes, they have specific functions in which they do in this cell. Na nitawaelezea tu kwa kiufupi tu na siendi ndani sana. Hope you'll enjoy, guys. So these genes, we have what we call the proto-oncogene. Proto-oncogene, these are genes which help the cells to replicate, or we can just call dividing. Inasaidia hizi cells kuzaana. The proto-oncogene, it gives rise to what we call the proto-oncoprotein, ambayo inasaidia cells kwa mwili wako kuzaana ili ziwe mingi na zifanye ile task ambayo inatakikana. Yep. And then number 2, we have got what we call the tumor suppressor genes. Wakati cells zako zinazaana, ama wakati proto-oncoprotein imesaidia cells zako zianze kuzaana, then now the tumor suppressor genes, it will come in to suppress the rate at which these cells are dividing. Sawa sawa? So the tumor suppressor gene ni kama opposition ya serikali, whereby it just comes in to slow down the rate at which the cells are dividing. Yeah? Now, the question is, how does cancer arise? We've talked about these 2 genes. How does cancer arise? Cancer arises when there is what we call mutation in either of these 2 genes. Kukiwa na kashida katika hizi genes mbili, we've talked about the proto-oncogene and we've talked about the tumor suppressor gene. Kukiwa na mutation ama kukiwa na kashida katika hizi genes mbili, then now the cells will replicate ama they will divide uncontrollably, hence causing what we call now the cancer. Yeah? So cancer will arise after now there is a defect or there is a mutation in these two genes. Yeah, now the cells will now begin to multiply ama divide. Let me use the word dividing or replicating. The cells will begin replicating and then they'll move from their usual boundaries. Najua kawaida cells ziko na nyumba yake, and when zimekuwa mingi kupita kiasi, they look for what we call a space or a room to move outside from where they are. Now these cells will now begin looking for a room to escape because there are many. Now when these cells are moving out, they'll form what we call a tumor. A tumor kwa Kiswahili tunaweza sema ni uvimbe mahali ama ni uvimbe unaotokea wakati hizi cells zimekuwa mingi, zinazaana na zinajaribu kutafuta namna. Yep. So there is a mutation in this either of these two genes ama hizi genes mbili ziko na shida. Cells zimeanza kuzaana kwa wingi na zimeanza kutafuta space, hence ina cause what we call kauvimbe ama katuma mahali. Yeah? So this tumor ama hii uvimbe ambayo imekreatiwa hapa it's in two types. Tuko na ile ambayo tunaita benign tumor na tuko na ile ambayo tunaita malignant tumor. Yeah? Naingia ndani kidogo tu, nastaki kuwapoteza, so nitaingia ndani kidogo tu. So what you need to do guys is kindly subscribe to our YouTube channel. This is your channel. Let's grow together. Subscribe, like, follow, share. And if you are looking for any information or you want your questions to be answered in regards to cancer ama saratani, iwe ni saratani ya sehemu yoyote, then this is your channel. Yep. So once we formed this tumor and we've said they are either benign or malignant. Benign ni kauvimbe tu mahali ambako kako localized. Localized ni kumaanisha uvimbe uko mahali na ujaenea. Then malignant tumor ni ile uvimbe ambao it has the ability to spread. Yani unaweza enea kwenda sehemu zinginezo. So hii uvimbe ama hii ambayo tunaita tumor, it is either solid tumor or it can be a blood cancer. Sawa sawa? It can either be a blood cancer or it can be a solid tumor. Solid tumor ni kakitu tu ka uvimbe ambako kako mahali fulani ama mahali kametokea kako mahali fulani. And then blood cancers, example ni kama leukemia. So this one imespread, imeenda to adjacent organs. Sawa sawa? Imeenda to adjacent organs. So allow me take you back an inch to what normal cells are and what cancerous cells are. So normally, normal cells, they replicate the same exactly. So what I'm trying to say is, vile wewe ulizaliwa ukafanana na wazazi wako, ama vile ulizaa mtoto akafanana na wewe, is the same case to cells. Yeah? They replicate themselves exactly. Inamaanisha kwamba hizi ambazo zimezaliwa zinafanana mzazi. Yeah? They replicate themselves exactly. Zinafanana the origin. But on the other hand, cancer cells, they don't replicate themselves exactly. Ina maana kwamba azifanani mzazi ama ile cell ambayo ili replicate ama ili divide. Sawa sawa? So number 2, normal cells ama kwa kawaida the normal cells sahihi vile ninavyokuangalia, these cells ama the normal cells, they stick together in one place. They stick together in a localized place. Sawa sawa? Cancer cells, they don't stick together in an area, meaning they detach. Sawa sawa? So cancer cells, they detach. Kudetach ni kama ni kuachana due to low calcium content. Zinafanya nini? Zina spread to other parts of the body. Sawa? Normal cells, they obey signals from others. Vile sisi tunavyozungumza na mtu mwingine, tunafanyia ishara, mtu anaangalia. The normal cells, they can destroy a damaged cells. When one of the cells is damaged, kuna vile hizi cells zina communicate by signals. Yeah? Then they destroy a damaged cell, one of the cell damaged. But on the other hand, the cancerous cells, they don't obey signals from other cells, meaning ziko tu cancerous cells, they are just there. Yeah, they don't obey signals from other cells and they can't destroy their cells. Sawa sawa. Then vile tuko na what we call normal growth curve, vile wewe ulikuwa mtoto ukakuwa teen, you became an adult, then you are now old, is the same case to normal cells. Normal cells pia ziko na growth curve. Kuna wakati ziko changa, kuna wakati zinakuwa, zinafika mahali, then pia zikifika kiwango fulani zinazeeka na zinakufa na zinatolewa kwa mwili. But on cancer cells or the cancerous cells, these cells, they do not mature. They remain immature. Yeah? They remain unspecialized. Yani ni kama ni cells ambazo ziko tu, ni cells ambazo ziko tu, they are just there. They don't grow, they don't undergo those stages of development. They are just immature. Yeah? Normal cells, tukuja tena kwa normal cells. Normal cells, ziko na, they stop replicating ama they stop division at a particular time. Like, let me use the example of women. Women, kuna mahali wanaanza, kuna umri wanafika ya kuzaa. Na kuna umri pia inafika wanaacha kuzaa. Ama kwa kimombo tunasema menopause. So, normal cells pia ziko na age ama ziko na duration ambapo zinawacha kuzaana. Sawa sawa? They reach a certain place where they do not divide or they do not replicate further. Sawa sawa? Kwa sababu ya hiyo curve ambayo nimeonyesha. Just like women. Now, on the other hand, the cancer cells, they do not stop replicating. They do not stop multiplying. I mean, they do not stop dividing. Dividing ni kuzaana. And you know cells, I use the word dividing because cell inakaa shape tu kama hii. So cell when it's dividing, it just detach. Zinakuwa mbili tofauti. Hii ingine pia inakuwa, inafika ina detach. So that's what we call dividing. Yeah? So cancer cell, they do not stop dividing. So if you've got this mutation ambayo tumeongelelea hapo juu, na hope sijawapoteza. If you got this mutation ambayo tumeongelelea hapo juu, these cells will not stop dividing and they will stay immature. Na zitatengeneza hiyo uvimbe ambayo tumesema ni tumor. Na this tumor, we have said it can be cancerous or it can be benign. Na tumesema benign is not necessarily cancerous. Benign ni kauvimbe tu ambako kako mahala fulani, kametulia mahala fulani, na it is not spreading. Yeah? Now, globally, 1 out of 2 men, they end up being diagnosed of cancer later in life. 1 out of 2 men, they end up being diagnosed of cancer later in life. 1 out of 3 women, they end up being diagnosed of cancer later in life. Now, what does that statistic tells you? In our subsequent episodes, we are going to learn how this 1 out of 1, which type of cancer is this that affects men the most, and what percentage is it? We are also going to talk about if 1 woman out of 3 are affected by cancer, which type of cancer affects women at a particular percentage. Ni gani ambayo ni kiwango ya juu, ama ni gani ambayo inafuata, ama ni gani ambayo inawaadhiri wanawake sana. Yeah? So when we come to Kenya now, cancer is the 3rd leading cause of death after what we call cardiovascular and infectious diseases. Cancer is the 3rd leading cause of death after cardiovascular and infectious diseases. Yep. So in 2017, Dr. Jackson Kioko, who was then the director of medical services, gave an estimate from a research that was done that we have 40,000 new cases yearly. We record a number of 40,000 cases of cancer yearly. And then we've got 27,000 cases of deaths, of fatalities yearly. Then what do these figures tell you? If we are screening people and getting an estimate of 40,000 people with cancer yearly, and then on the other hand we have 27,000 people dying from cancer, then what does this tell you? Maybe you can talk about we are not having our things right. We don't have the infrastructures. We don't have the resources. We are not equipped to fight this cancer. Maybe we don't have the specialists. Maybe we are not having something right if we are losing 27,000 people from cancer yearly, from cancer alone. Yeah. So what does that again tells you is that in the next 10 years to come, if we don't contain this issue of cancer ama saratani, ni kwamba tutakuwa katika nafasi mbaya. We'll be in a very bad position 10 to 15 years to come if we don't make baby steps now and contain this issue of cancer. Then it means in the coming 10 to 15 years we'll be in a very bad state. Yeah. So guys, let's grow our channel. This is your channel, as I've just said. Do anything you can with this information. You can share it, you can like, you can follow, you can subscribe. Let's grow this channel so that we can learn and know how to avert this cancer before it now proceed. People ask about the types of cancer. There are so many types of cancer, and before I just name the types of cancer, it's fine or it's wise for you to know that cancer can affect any part of your body. Saratani ni ugonjwa ambao unaweza affect kiungo chochote cha mwili wako, be it the liver, be it the brain, be it the skin, be it the kidney, be it the pancreas. So cancer can literally affect any part of your body. The types of cancer just include breast cancer, cervical cancer, prostate cancer, colorectal cancer, multiple myeloma, leukemia, cancer of the esophagus, cancer of the stomach, pancreatic cancer, talk about sarcomas and lymphomas. So there are so many types of cancer, and we are going to discuss each and every type of cancer, their causes, anything you need to know about a particular type of cancer. So we are going to talk about them. Now, the questions that you and I should be asking at this moment, the questions that you and I should be asking at this particular moment is it true that excessive use of tobacco or cigarette smoking is a causative agent of cancer? Ni kweli kwamba kufuta sigara kwa kiasi ama tobacco inapeana cancer? Kama ni kweli, why is it cheap and why is it legal? Yeah? Is it true that consumption of illicit brew or alcohol is a causative agent of cancer ama inaweza sababisha saratani? Kama ndio, which type of cancer does it cause? Yeah? And how does it cause that type of cancer? Yeah? Reusing of cooking or frying fats or oils, does it cause cancer? Tuseme umepika mandazi yako, ile mafuta ambayo ilibaki pale, unatumia kupika chakula ingine kesho, unatumia kupika kitu ingine kesho. Is it true that reusing of this cooking oil or fat is a causative agent of cancer? We'll get to know. So is it true that unhealthy lifestyle can cause cancer? Unhealthy lifestyle can cause cancer. So why should I tell you that your lifestyle is unhealthy and that mine is healthy? Or why should you tell me that my lifestyle is unhealthy and that your lifestyle is healthy? So what is the measure of this lifestyle thing? Ama ni mbinu gani tunatumia kusema sasa hii, now this is an unhealthy lifestyle and this one is not an healthy lifestyle? Yeah? Is it true that being fat, being obese, lack of exercises is a causative agent of cancer? We'll get to know. Yeah? Is it true that agrochemicals contaminated with food, tuseme umeenda pale sokoni umenunua nyanya zako zilikuwa zimepigwa dawa vizuri, umenunua mboga zako zilikuwa zimepigwa dawa vizuri kwa sababu labda mkulima hataki kupata hasara, mkulima mdogo, mkulima mkubwa wataki kupata hasara, wakazileta sokoni, wewe ukachukua zile matunda, you didn't do thorough washing. Is it true that these chemicals can lead to cancer? Is it true that some beauty products zile ambazo tunatumia pale, tuseme mafuta pale, tuseme zile kemikali tunatumia, tuseme zile mafuta za nywele, tuseme the beauty products, is it true that they cause cancer? We'll get to know. Is it true? Yeah? Is it true kwamba cancer ama ugonjwa huu wa saratani is hereditary or genetic? Is it true kwamba kama mzazi wako alikuwa na kansa atapatia wewe ama na wewe utapatia mtoto kansa? Kama kweli there are types of cancers that are hereditary, what types of cancer are hereditary and what percentage are they? What percentage are they? Yeah, so these are some of the questions that you will get to get the answers. So my appeal to you is that you can't afford to miss the subsequent episodes. You can't afford to miss the subsequent episode. So guys, kindly, every Tuesday I'm dropping an episode. Be there, like, subscribe, share, follow, do anything you can do with that piece of information, and we'll get to do better things together. Thank you guys.